Hello everyone, this is Dr. Sanyukta Srivastav. The topic of today's video is deprogramming and recording centric relation. If you have not watched my previous videos, I would request you to please go back and watch my video on understanding the normal temporomandibular joint and demystifying centric relation, because if you watch those two videos, then you'll be able to understand this video. This is going to be a long video, and you would need 2 to 3 revisions to understand this concept and assimilate it better. So let's get started. Most of us know that to record centric relation, we have to deprogram the patient and record the bite. Now, a logical question will follow. Why can't we ask the patient to just swallow and close? Because traditionally we have learned that as soon as the mandible goes to rest, it falls to centric relation. Why isn't that possible that we ask the patient to just lie down, not let his teeth meet, and put a bite registration material and record the bite? Why do we have to deprogram the patient? And what is this deprogramming all about? To understand all this, we first have to understand what are we deprogramming. Deprogramming is nothing but asking the muscles to forget the program. Now, what is this program? The program is a muscle engram. Now, let me make it uncomplicated. Forget whatever I said till now. Just imagine a state where we had to get up in the morning every day and start to learn to walk again. Start to learn to talk again, learn to eat again, learn to read again and write again. Would life be possible? It would be impossible. Thanks to a group of neurons in our brainstem, which is called as the central pattern generator, that remembers the muscle programs which are responsible for carrying out day-to-day activities like walking, breathing, eating, talking, masticating. Now, this central pattern generator is continuously sent informations from all of our body to perform the tasks efficiently. Consider our chewing stroke. The teeth, the periodontal ligament, the tongue, the cheeks, the lips are constantly feeding back information to this central pattern generator to determine an efficient chewing stroke that can accomplish the task of mastication without causing injury to lips or teeth or tongue. When an efficient pattern is learnt, it is recorded in the central pattern generator and repeated every time without you realizing that you are doing something. Isn't that good? That's good, because we don't have to be conscious about whatever we are doing. These programs that are fed into the central pattern generator are called as muscle engrams. Then what is the problem? The problem with muscle engrams is their affinity towards efficiency. These muscle engrams like to fulfill every task in the shortest possible time. So the task of mastication has to be done in the shortest possible time, whether it overloads your joints or your muscles or destroys your teeth. Now come back to the rest position of the jaw. We all know that when mandible is at rest, it falls back to its musculoskeletally stable position, that is the centric relation. So the condyles seat over the intermediate zone of the disc, and the condyle disc assembly goes and sits in the articular fossa in the anterior-superior position. But as soon as you start closing your jaw, that is during swallowing or chewing or during parafunction, only a few teeth meet at first. The central pattern generator kicks in and it puts the muscle engram to work. To eat, it is not possible that you contact only 2 or 3 molars and eat all your food. So the task for muscle engram is to make all or maximum number of your teeth to meet. If you remember, inferior lateral pterygoid is a depressor and the elevator's function is to elevate. When we are closing our jaws, only the elevators should act and when we are opening our jaws, only the depressors should act. But when we are in centric relation and closing our mouth and only a few teeth are meeting, you need all or maximum number of teeth to meet, then you need the jaws to move forward and upward. Now remember, in centric relation, it is not possible for the condyle to move vertically upwards or forwards or backwards. So if the jaw has to be moved forward, the condyle has to come out of centric relation. If the jaw has to move forward, the inferior lateral pterygoid has to pull it forward. So the inferior lateral pterygoid under the muscle engram pulls the jaw forward. Now to close the jaw in this forward position, the elevators have to act upwards. The elevators usually act against only gravity, but now they have to act against the forward pull of the inferior lateral pterygoid, upwards as well as backwards to close the jaw. The condyle is already out of the centric relation. So the muscle engram, every time when you are closing your mouth, is putting the inferior lateral pterygoid to task against the elevators. These two antagonistic groups of muscles pull the condyle forward, then upwards, then forwards and upwards to let your teeth meet again and again to chew your food efficiently in the shortest possible time. Over a period of time, these muscles become hyperactivated. In some patients, they will result into muscle symptoms like pain in their masseters or pain in their temporalis or pain behind their third molars or pain below the jaw or pain below the central incisors in mandible. In some patients where the periodontium will be more affected, the patient will complain of sensitivity with the lower teeth or sometimes with the upper anterior teeth or sometimes with the lower anterior teeth. These patients may also come to you with abfraction lesions, with microfractures because of uneven loading of the teeth. Due to continuous anterior and posterior pull over the condyle, the superior and inferior drag over the articular disc by the condyle, the disc derangement disorders are also kicked in. It is in these patients that you would need to take intervention. They would come to you for restoration of the dentition, where you do full mouth rehabilitations, or with muscle symptoms, where you have to treat the muscle disorders, or with intracapsular symptoms. Now, do you think that without dealing with this muscle engram, you can treat any of these disorders? You need to either rehabilitate this patient into centric relation by doing full mouth rehabilitations. Now, is that possible to do full mouth rehabilitation in the current maximum intercuspation position? Even if you give a perfected occlusion in maximum intercuspation, when the patient goes back to rest, the condyle is going to go back to CR. And the muscle fight will continue while the patient eats, because now the patient will again have to come to maximum intercuspation to eat. Your prosthesis will be falling apart. The muscle symptoms will go on continuing, and the temporomandibular joints will keep on worsening. In these patients, if you want to treat muscle disorders and want to locate the first point of contacts, do you think is it possible to let the muscle engram work and still find the first point of contacts? No. That is why we want these muscles to forget the program. This method of making the central pattern generator forget the muscle program is called as deprogramming. This is what is deprogramming all about. So how do you deprogram? Remember, it was the first point of contact that kicked in the muscle engram. So you would want to remove the influence of tooth contact on muscle function. You can do that by making a flat anterior plane behind the upper centrals such that it is perpendicular to the lower centrals. Ask the patient to tap on that flat platform and ensure that none of the posterior teeth are meeting when the patient is tapping on the teeth, and moving the lower teeth on the upper platform from front to back and from side to side. There should be a complete disocclusion of the posteriors starting from canine to the last tooth in all excursions. Now, when the patient taps his lower teeth on the upper platform repeatedly, it sends impulses to the brain that none of the posterior teeth are meeting. So, the inferior lateral pterygoid muscle does not need to function. Over a certain period of time, the inferior lateral pterygoid muscle will completely shut off, since it is not required during closure of the jaw when only the front teeth are tapping. It will send impulses to the elevators to shut off all the hyperactivity that was needed to pull the jaw against the pull of the depressor. The repeated tapping will also send impulses to the brain to ask the elevators to pull the mandible up, as there is no posterior hindrance. The natural pull of the elevator muscles will bring the condyle into the musculoskeletally stable position, that is your centric relation. Now you can ask the patient to lie down on his back. Now you can make the patient lie down at rest for a particular period of time. This time depends upon what the status of the patient's masticatory musculature is. In a patient with a normal temporomandibular joint and no muscle disorder, it would typically need 30 minutes for the muscles to forget the muscle engram. The mandible will fall back to the musculoskeletal stable position and the lower incisors will shift back on the flat platform. Once you do the load testing, you will come to know whether the condyle is in centric relation or not. After you have verified the centric relation, you can go ahead, put bite registration paste between the posterior teeth, and your centric records are done. Now, a word of caution. It is possible to record centric relation this way in most of the patients who do not have any muscle disorders or who do not have any intracapsular disorders within 30 minutes. For patients who have muscle symptoms like pain in their masseters or in their temporalis, or who are coming to you with other associated complaints of temporomandibular disorders, you might need to deprogram them overnight for 15 days before you can record a correct centric relation position. Another point to remember is that in patients with intracapsular disorders, particularly the disc derangement disorders, it is not possible to record centric relation because the disc is not at its correct position. And you remember that centric relation is the correct position of the condyle over correct position of the disc against the articular fossa. When the disc is not in its correct position, it is not possible for you to record the centric relation. In these patients, you have to develop a pseudocentric position before you can record that pseudocentric stable position. That's all for today. I hope I could make you understand the concept of muscle engrams, deprogramming, and recording centric relation. To know more about full mouth rehabilitations and temporomandibular disorders, please stay connected to me. Thank you.